Hello everyone, my group and I will be presenting about how we envision the world of healthcare to look like 10 years from now. We take into account the digital transformations as well as advancements in technology in presenting to you the possible future of healthcare. And these are the things that we will be covering in this video presentation. For our vision and mission, we aim to predict how technological advancements and digital transformations would impact the healthcare industry in the near future. Well, of course, since healthcare is such a big topic to fully analyze, we have chosen to narrow it down to these areas of the industry, specifically primary care, rehabilitation services, and mental health services. And we hope to achieve this through research and by utilizing the existing digital platforms, technological devices, and companies which have thus far transformed the industry.
We have chosen to explore the possible future of healthcare since the healthcare industry is projected to expand by 90%, making it the second fastest growing sector. Moreover, there is increasing demand for healthcare insurance and the need for more people to fill jobs in the healthcare industry. According to a 2020 survey of healthcare consumers, an ideal healthcare experience requires a personal touch, whether that encounters occurs virtually or in person. Last but not least, healthcare futurists believe that by 2040, most care will be delivered at home, in outpatient setting, or virtually. Through our research, we have identified the following issue in the current healthcare system. First, many people believe that each doctor has their own judgment, making people concerned about patient safety and the quality of the healthcare provider. Second, there is a lack of sufficient number of doctors and nurses to serve the community. As a result, medical staff are overwhelmed and overstressed. Third, healthcare costs change people's behavior, with many foregoing seeing a doctor when they feel sick or avoiding preventive health visits entirely. Fourth, some hospital does not have an advanced system, resulting in the doctor being unavailable at a particular time, even though there is a long queue. Fifth, it is understandable that doctors and nurses may be busy. However, there is a lack of communication between patient and the health providers, resulting in ineffective and inefficient recovery. Sixth, on some occasion, doctor's recommendation is not based on accurate calculation or judgment, leading to an unnecessary treatment or procedure that could negatively impact the patient condition.
So, an example of an existing device that is a product of both healthcare and technology is the Dyson headphone mask, because it combines both personal safety and entertainment. It includes a contact-free visor that contains purified air, which aims to protect users from potential airborne particles. And it is also an app that you can download to monitor the surrounding air quality, the machine filter, battery life of the headphones, as well as control the sound according to your listening preferences.
Apple Watch healthcare function provide many features, such as sleep quality record, heart rate detector, medical reminder, fall detection that allows the user to easily call emergency services, and medical IDs that could help first responders to make accurate treatment or decision. These features allow the user to be more aware of their health. Moreover, Apple Watch could be connected to iPhones, allowing users to get more information and details. Not only to access just personal health information, but users can also get education in healthcare sectors through the Health app. In addition, users could also share their personal health information with their family or relative. These features are beneficial tools, especially for the elderly. Their children or personal healthcare providers could get instant access and update on their health condition in real time.
Another example is telemedicine application, for example, Mana Doctor, Whitecard, and Doctor Anywhere. Users can communicate with healthcare professionals through text message or video call to obtain a diagnosis and learn about available treatments. Users can also obtain care remotely, which is comfortable and convenient because virtual appointments can more easily fit into users' busy schedules.
So in this section, we will discuss the roles of patients, care providers, and the government in the specific areas of healthcare, particularly primary care, rehabilitation services, and mental health services. Primary care includes the basic healthcare services that people need on a regular basis, such as routine physical exams, diagnosis, and treatment of common illnesses. The use of telehealth has grown significantly during the COVID period through platforms like Zoom and Google Meet. Healthcare providers could assist consumers remotely without needing to meet physically. These were all made possible through internet access on mobile phones, laptops, and tablets, along with factors like the consumers' and health providers' willingness to use telehealth. Even though we're now living in a new normal, post-pandemic, consumers and providers continue to use virtual health services like telehealth consultations because of its convenience and shorter wait times as opposed to a physical visit to the clinic. Next, we'll talk about the utilization of personalized medicine in primary care. Personalized medicine utilizes each person's genetic makeup, which could lead to a more effective treatment of individuals, and then shifting the emphasis in medicine from reaction to prevention. Through this, there is an opportunity to improve the feature of individualized healthcare for all citizens. So, in short, for consumers, personalized healthcare will become more patient-focused. They'll have more control over monitoring their own health and have more freedom in deciding what services they'd like to use. The digital health resources will also be more accessible to both consumers and providers because of better interoperability. For the healthcare providers, the new and existing technology will possibly help reduce the physician burnout. There will be possibly a greater understanding of disease detection through genomics. AI and machine learning systems can help gather the bigger data of patients and consumers. Ultimately, the optimization of the technological systems could provide better predictions, which may improve the efficiency and effectiveness of treatment, especially for the uncommon diseases.
There are 4 major advancements of technology in rehabilitation services. First, robotics, flexible manufacturing, and additive machining will transform wheelchair design and usage. Second, technology and machine will cover the nurse role in assisting disabled patients. Third, the advancement in technology provides more accurate data collection, which is essential in decision-making and further research. Fourth, machine-assisted devices would be used in repetitive treatment and physical therapy for faster recovery. For consumers, AI enables assisted physical therapy. Artificial intelligence could maintain the patient therapy in the right way according to their specification and needs. Second, wearable sensors and vision-based motion capture technologies. For instance, Motion Coach, an app by Kaya's company, used the device's front-facing camera to measure body parts movement. Third, robotics and AI provide communication services and dialogue. Patients connect wireless motion trackers to their bodies as part of the system. There will be real-time feedback from a digital therapist, such as raise your leg higher. For workers and healthcare providers, AI application assists clinical decision-making and health outcome monitoring. Evidence-based medicine has grown in significance due to its emphasis on systematically studying clinical data and using the best available information to guide their treatment decisions. Second, advances in technology allow more accurate data collection. Data mining makes it easier for medical staff to initiate treatment early and reduce potential morbidity and mortality. Third, electronic lift system and smart beds to assist. The emergence of electronic lift system and smart beds could prevent healthcare workers from burnout or exhausted, as nurses can assist patients who are unable to stand or move into their beds without using too much energy. For government, the rise of technology provides more accurate and transparent data on healthcare trends, allowing the government to relocate funding from the most crucial project to the least important one. As a result, healthcare sectors could be more effective and efficient in accommodating and treating patients.
Moving on to the mental health services, personalized healthcare services, enhanced teletherapy, and virtual reality therapy will be focused in the future. In personalized healthcare services, users have choice and control or customize their diagnostic methods over the way their care is planned and delivered. Since many people are busy and live in rural areas, enhanced teletherapy will also make treatment easily available and eliminate obstacles including schedule conflicts and transportation problems by utilizing applications for access therapy. For VR therapy, it offers individual more realistic simulation through wearable devices that can project a VR landscape so that users will be immersed. Individuals who have phobia issues can expose themselves gradually to the phobia trigger in a controlled and safe environment. In the future, we believe technology can help consumers to prevent mental issues rather than treatment. Enhanced teletherapy also breaks down geographical barriers, which enable them to access therapy at home. AI technology, which offers exposure therapy, can also help consumers to treat phobia. For the workers and healthcare provider parts, technology can help to gather quantitative and qualitative data and enable systematic data analysis. Also, AI technology offers real-time tracking and errorless treatment. For the government part, big data analysis and AI technology provide governments with accurate data on healthcare so that they can organize public education and awareness campaigns to ensure everyone is aware of health risks to prevent the development of diseases. Moving on to the possible invention in the future, we believe that in the future, hyper-connected bathroom will be innovated for healthcare purposes. Highly attuned sensors embedded in a bathroom mirror can help to detect and analyze health information, anomalies, and track body temperature and blood pressure. It also offers personalized skincare tutorial for users. Besides, tech-enabled toilet can spot biomarkers and indicate a potential change in health status so that users can prevent the development of diseases. Another possible invention is enhanced wearable devices. It can track diet and calories intake for people who need to be aware of their eating habits. Also, it can analyze sleep quality by providing critical insight into your nightly sleeping patterns. It can identify different hypertension issues and detects irregular and abnormal heart readings. Enhanced wearable devices can also provide medication reminder, which is beneficial for people who have dementia.
To conclude, there is a need for attention on current healthcare issues, and the government should be pushed to take action because right now the priority goes to financial means rather than a patient-focused approach. And to our next point, utilization of AI and machine learning will be better integrated into the healthcare industry. This can then alleviate the shortage of professionals and reduce physician burnout. As for capitalism, it will continue to increase as technology advances. It does drive efficiency and competency among workers, along with the invention of the machine-aided designs. Primary focus of healthcare will then shift from treatment to risk definition and prevention, and the shift to a more hybrid or virtual model of access to healthcare services would then enable further collaboration between patients and healthcare providers, while the government's role stays rather consistent by providing incentive to the public and implementing policy changes to healthcare.